How do you address the potential impact that genomics testing could have on patients' family members?
With any genetic or genomic test that we're doing, there's the potential implication that it might have an impact on other family members. So whatever you pick up, you might find actually there's other people in the family that also carry that, and therefore it's got implications for them, for the children that they have, or the children that they might have in the future.
But if we're looking at the germline DNA and we find a pathogenic variant, then it often means that other relatives are at risk of carrying that as well. It's very helpful to raise this in the pre-test counselling when the patient is actually being consented for the test, rather than waiting until the results have arrived.
There should always be a way for family members to connect to, or instructions for them to connect to a health professional once the results have come through. There's a clear explanation to the person who's got the results and how they could relay that to the family member, and the support that's available for them.
A lot of the time it's really straightforward and there's good communication in families, but it's really not that unusual for there to be breakdowns in relationships in families either. So if you establish that there's likely to be some sort of difficulty, then you can start to work out what you can do to help.
We can try and mediate between family members. They may not speak to each other, but they can. We try to help them find solutions about passing information on. If they really don't want to pass that information on, then we try and think about what else we can do.
You can start to give some ideas about how they can communicate that information, what sorts of pathways of communication they already use with that family member. If they don't talk to a brother, actually does their sister talk to that brother? Can they use that to get the information out there? But until you understand any of that, the danger is that you can make an assumption that it's all going to be fine. So to me, it's about understanding a little bit more about the family and the family dynamics than just saying it's genetics that might be important for your family and leaving it there.